Hi, I'm Andy Barkmeyer. I'm a vitreoretinal specialist at Mayo Clinic Department of Ophthalmology. In our retina specialty clinic, we have a large percentage of patients with diabetic retinopathy and diabetic complications. And in this video, I'd like to discuss our diabetic photo screening program and what our goals are. Diabetic retinopathy is a complication of long-standing diabetes where the tiny blood vessels in the back of the eye and the retina are damaged from elevated blood sugars and some of the other complications from diabetes. The problem with these damaged blood vessels is they may leak and cause swelling in the retina, and this can decrease a patient's vision. The other problem with these tiny blood vessels being damaged is they can become blocked off, and this in and of itself can damage the patient's vision. And also, by getting blocked off, some of these blood vessels can create the growth of new blood vessels, which can bleed or they can cause tractional retinal detachments. And if your retina becomes detached or if you have severe bleeding in the back of your eye, you can dramatically lose vision. The goals of our diabetic screening program is to increase the percentage of patients who get their annual screenings. The problem across the United States right now is only about 50% of diabetic patients receive their annual exams. And many young patients, particularly who have no symptoms, do not get the care they need at a stage that we're able to prevent blindness. The most ideal patients for our diabetic screening program are patients who have no visual symptoms, who are otherwise very healthy with respect to their eyes and do not need a refraction for eyeglasses or contact lenses. They basically just need their diabetic retinopathy screened. Patients who would not be as an ideal candidate would be patients who have either any other kind of eye disease, such as glaucoma or more advanced cataracts, or problems with their cornea or any other part of their eye where they need regular eye exams. Also, patients who are in a wheelchair are a bit more difficult to photograph accurately. Any patients who have any visual complaints, any concerns with their near vision or their distance vision, or any concerns whatsoever with their eyes, it would be better just to have a regular eye exam as opposed to the photo screening, because we're not able to see the front of the eye and examine the eye in its entirety, but we can see the retina quite well. And the process for the exams are we take two 45-degree photos of the optic nerve and of the macula in the center of the vision. This works best with dilation of the eyes, but what we've found is some patients, if they're in their primary care clinics, if they don't have a driver or for some other reason, they may not want to be dilated, and this may prevent them from getting their photo screening on the same day of their eye clinic, or on their general clinic visit. If they aren't seen on that same day, we've found that it decreases the chance that they'll get their photo screening or their eye exams. We're more than happy at any point to see patients in our regular eye clinics. So once a primary physician who takes care of a patient's diabetes identifies that patient as a good photo screening candidate, the patient will have their eyes dilated. Occasionally, we would offer undilated exams for patients who cannot be dilated that day and wish to try to have their photo screening as well. Patient has to understand in these circumstances that we may not get adequate photos to grade and they may need to have a dilated exam in the near future. From a patient's perspective, after you have your eyes dilated, your vision will be blurry for 4 to 6 hours. If you're planning on having diabetic photos taken at the time of your primary care appointment, it may be a good idea to bring a driver. After we check your eye pressure and check your vision, we'll take some photographs where your head will be placed up at a machine and you'll see some bright flashes of light, and we'll have you look in a couple different directions. The photos will be taken and they'll be sent along a secure server to be graded by a retina specialist within about 72 hours. Patients who have no evidence of diabetic retinopathy on their photo screening will have a note sent to the primary care doctor, and the primary care doctor will be able to arrange for a repeat photo screening in about a year. If a patient does have some diabetes changes in the back of their eyes that we see on the photos, the primary care physician will be notified. We'll also set up an appointment for the patient to see an eye care specialist within several months. If a patient has other reasons that they wouldn't be a good candidate to have photos screening in the future, such as glaucoma, or we see other changes in the back of the eye that we feel needs a regular eye exam, we'll arrange for an eye exam as well. If we see on the photos that there are some changes in the back of the eye that are particularly concerning, or if we're unable to see what we're trying to see, either due to the photos not being of adequate quality or from something inside the eye that's blocking the view to the back of the eye, we'll set up a relatively urgent appointment with an eye care specialist to further evaluate what's going on in the back of the eye. In this situation, a note will be sent to the primary doctor as well, and we'll arrange for that appointment.